Hello, my name is Ashley Eddington, and I would like to talk to you about aortic aneurysms today. There are two types of aortic aneurysms that have similar symptoms and risk factors and treatments. And the more we know about them, hopefully we can survive them better. The two aortic aneurysms are called a thoracic aortic aneurysm, which is in your chest cavity, and it's in the main part of the aorta coming out of the heart, which is a bulge in the wall of the aorta, and it can get big enough to rupture and you bleed out. The second one is abdominal aortic aneurysm, and that's in the core of your body, and most of the time it's down around your kidneys. This is the one they pay more attention to because it is the 14th leading cause of mortality in the United States. There's approximately about 4,500 deaths a year with abdominal aortic aneurysms. So the more that we know about them, the more we can get help with them. Some of the risk factors for these aneurysms. Hang on, I want to show you a picture. These are the aneurysms. This one right here is a thoracic aortic aneurysm, and this one down here is the abdominal aortic aneurysm, and this is healthy right here. They look a little scary, but they can be treated. Some risk factors to these aneurysms is chronic high blood pressure, chronic stress, which causes high blood pressure and rapid heart rate, atherosclerosis, which is a hardening of your arteries, and your age, which 1.5% of men older than 60 and 1% of women older than 64 are affected with abdominal aortic aneurysms. Family history of high blood pressure, diabetes, and stuff like that. Infections can cause these, such as salmonella and syphilis. And then connective tissue disorders, such as Marfan syndrome and Ehlers-Danlos syndrome, which is a weakening of the connective tissue, which won't hold the vessels and the valves where they're supposed to be. Birth defects, such as being born with an aorta that has an aortic valve with two valves instead of the three that they need, so it can pump real strong for us. And some people are born with two, and it's not as strong, and it doesn't hold the blood where it needs to go when it needs to go. Some of the symptoms for these aneurysms are sudden or severe chest and abdominal back pain, you need to get some help. If you're feeling lightheaded or dizzy, talk to your doctor. If you have difficulty swallowing or breathing, that means that the bulge is getting bigger or it's there and it's obstructing something and we need to get it checked out. Rapid heart rate goes along with blood pressure. Feeling full after a light meal, that's for an abdominal aortic aneurysm. It's obstructing and we need to get it looked at. Swelling of the face, neck, or limbs means we're retaining fluid and our vessels in our lymphatic system are not doing what they need to do. Something's wrong. We need to get it checked out. To prevent or to treat, the doctors will have you diet and exercise in case you have a high salt, high sodium, high fat diet. He'll want to cut that stuff out. He'll want you exercising a little bit more, quitting all tobacco products. He'll give you medications such as beta blockers or atorvastatin or simvastatin to help lower your heart rate and lower your blood pressure. He or she, they may also suggest a surgery, which I have pictures for that. And this is an abdominal aortic stent, which they're bypassing the aorta so the blood can flow normally where it needs to go. And then this is a thoracic aortic stent. As you can see, it's a little bit better than my last picture, where it bypasses the aneurysm right here, which the aortic wall is the weakest, so the blood can flow nice and evenly through the vessel. It's not being stopped or anything. It'll help even out the blood pressure and the heart rate. What you can do to try to prevent these is, again, a regular healthy diet and exercise, regular visits to your doctor so they can do regular screening for that stuff and help you manage your blood pressure, diabetes, cholesterol, anything that could cause it, and avoiding all tobacco products. So we need to have a healthier lifestyle, getting regular checkups by your doctor, and being aware of the symptoms so you can go to your doctor and be like, hey, something's not right. I need help. um, we want to get treated before a rupture happens, so we're not part of the 20% that hopefully survive a rupture. Getting treatment and the surgery would prolong your life by at least 5 years. So let's go to the doctor and eat healthy. Thank you.